The dishes clink in the sink and your whole body tenses up. Or a car horn goes off 2 blocks away and it feels like it hit you right between the ears. Your kid's laughing in the next room, something you love, and you find yourself bracing. That's one of the cruelest parts of something called hyperacusis. It makes normal life feel unsafe. Not because you're fragile, not because you're imagining it, but because your auditory system is reacting to everyday sound as if the volume in the world has been permanently just cranked up. And here's the part that surprises most people. The most natural response, avoiding sound or wearing earplugs everywhere, trying to live in quiet, can actually make the problem worse, not better. I'm Dr. Layne Garrett, founder of Timpanogos Hearing and Tinnitus in Utah. I've been evaluating and treating sound sensitivity conditions for over 20 years. Today, I want to explain what hyperacusis is, what's likely happening in your brain, and what real treatment looks like, because this is not a condition where learn to cope is the best we can offer. Hyperacusis is a condition where normal everyday sounds are perceived as disproportionately loud or uncomfortable or painful. Sounds that most people around you experience as completely ordinary. The key word is perceived. This isn't about the sound being louder, it's about how your auditory system is processing it. Now, it's worth separating hyperacusis from two things it gets confused with all the time. Misophonia is a strong emotional reaction, usually anger, to specific sounds like chewing. Phonophobia is a fear of sound that's tied to anticipatory anxiety. Hyperacusis can overlap with both, and evaluation matters precisely because these labels can get blurred. But at its core, hyperacusis involves the auditory system's gain control, and I'll explain what that means in a moment. One thing worth knowing here, a significant percentage of people with hyperacusis also have tinnitus. That's not a coincidence. The two symptoms share underlying mechanisms. So what's going on? The best current explanation we have is what research called the central gain model. Your auditory system doesn't just passively receive sound, it actively regulates how much it amplifies incoming signals. Think of it like an internal volume knob that your brain adjusts based on what it's getting. When something disrupts this normal sound input, noise exposure, illness, head trauma, hearing loss, the brain can respond by cranking up that internal gain. It's trying to compensate, and in the short term, that might be useful. The problem is when that gain stays turned up. Now your auditory system is over-amplifying everything. Normal sounds come in, your brain processes them though as if they're far more intense than they really are, and what everyone else hears as ordinary becomes overwhelming to you. This is also why hyperacusis and tinnitus oftentimes are seen in the same patient. The same gain dysregulation that makes external sounds feel loud can over-amplify internal neural noise that gets perceived as ringing or buzzing. And here's the piece that matters most. If this is a calibration problem, treatment is about recalibrating the system, not hiding from the world, recalibrating your hearing system. Real quick, if you've been searching for straight answers on hyperacusis or tinnitus and keep finding the same vague advice, subscribe to our channel. I put out videos like this twice a week, real clinical information, not wellness fluff. Now, let's talk about the biggest mistake people make when sounds start to hurt. The instinct makes sense. If sound hurts, protect yourself from the sound. Use earplugs, noise-canceling headphones, stay in quiet rooms, avoid restaurants, skip family gatherings, and over time, that shrinks your world. I've had patients tell me they stopped going to restaurants, then to church, then to family birthday parties, not because they didn't want to be there, but because one sudden sound could wreck the rest of their day. That's a real thing, and it's heartbreaking to see. But here's the problem. Chronic sound avoidance typically makes the hyperacusis worse. A foundational study by Formby and Gold demonstrated this directly. People who wore earplugs continuously for 2 weeks showed a measurable decrease in their loudness discomfort levels. That means their tolerance for sound dropped. A second group using sound generators over that same period showed the opposite. They had improved tolerance to loud sounds. The reason goes back to that central gain we were talking about. When you deprive your auditory system of sound, the brain compensates by turning the volume up more. Silence trains your brain to become even more sensitive. Now, this doesn't mean we throw you into loud environments and tell you to just tough it out. That's not how this works. But it does mean that strategic sound engagement, not protection from the world, is part of your treatment. So what does treatment for hyperacusis look like? Sound desensitization therapy is the foundation. This involves systematic exposure to low-level broadband sounds, typically delivered through a wearable sound generator. The goal is to gradually recalibrate the central auditory gain. We start at a volume that's comfortable, then slowly we build the tolerance over time. That's not flooding, it's controlled, gradual re-engagement so the auditory system learns that sound is not a threat. A 2024 field trial published in the Journal of Speech, Language, and Hearing Research by Formby and colleagues tested exactly this kind of protocol, combining structured counseling with therapeutic broadband sound in people that had debilitating hyperacusis. Over 6 months, participants showed an average improvement of 34 decibels in their loudness tolerance. To put that in real terms, sounds that were completely intolerable at the start of the trial were comfortable at the end. Cognitive behavioral therapy, or CBT, is another major pillar of treatment here. A 2025 review in Brain Sciences summarizing the evidence for CBT and hyperacusis found that both audiologist-delivered and psychologist-delivered approaches produce meaningful improvements in how much hyperacusis disrupts daily life. CBT is not aimed at changing the ear sensitivity directly, but it addresses the fear, the hypervigilance, and avoidance behaviors that keep your nervous system on high alert and progressively narrow what feels livable. For many patients, those behavioral patterns become as disabling as the sound sensitivity itself. Where hearing loss is also present, appropriately fitted hearing aids can help by keeping the auditory system engaged with ambient sound. That's the same principle we were using with sound enrichment with the sound generators. And lifestyle factors matter more than most people expect. Poor sleep, chronic stress, and anxiety all lower the threshold for sound discomfort. We address those as part of the plan, not as an afterthought. If you're trying to find help for hyperacusis, there are a few specific things that a thorough evaluation need to include. Loudness discomfort level testing that measures your tolerance and how it varies across different pitches. A standard hearing test alone is not enough. Many people with significant hyperacusis have completely normal hearing. Assessment of whether tinnitus is present and how the two conditions may be interacting. A real conversation about your avoidance behaviors, because those behaviors are part of what treatment needs to address. And a provider who understands that the goal is gradual sound re-engagement, not permanent protection. If your last test consisted of a basic hearing test and recommendation to wear earplugs, that was not a good hyperacusis evaluation. It might be worth getting a second opinion. Hyperacusis is real and it's genuinely debilitating, and it does not get enough clinical attention. But it's very treatable. The central gain model gives us a coherent explanation for what's happening and a clear target for treatment. Graduated sound exposure, CBT, appropriate sound enrichment, and lifestyle support can meaningfully shift how your auditory system responds. The most important thing I want you to take from this: avoidance is not a treatment plan. For most people with hyperacusis, it's a path towards more restriction and more sensitivity to sound. There is a much better approach, and the research supports it. If you're here in northern Utah and you've been told just to wear earplugs or avoid sound, it might be time for a more complete evaluation. At Timpanogos Hearing and Tinnitus, we assess hearing, tinnitus, loudness discomfort, sound tolerance patterns, and avoidance patterns that can keep your nervous system stuck. You can schedule an appointment in one of our clinics along the Wasatch Front. The link is in the description below. If you're not local, I've put together a free learning center with in-depth guides on hyperacusis, tinnitus, sound sensitivity. There's no email required, just good information. You can find the link in the description for that as well. And don't forget to leave a comment. Are you dealing with hyperacusis? What's been your experience with finding help? Your story can help other people watching this know that they're not alone. Thanks for watching.